Thanks, Julie. I appreciate it. Like Julie said, I'm a nurse practitioner. I actually just recently transitioned to a family practice role, but prior to this, I worked at the Cancer Center for the last several years. And so we're going to talk a little bit further today about sexuality as it pertains after a breast cancer diagnosis and in the survivorship stage. So, when I started getting this talk prepared, I wanted to look at a little bit of the statistics and how many people this affected. And I found it was really interesting. The last year that we have any data for this, just because of the way that they look at statistics, it's several years past, but in 2018, there were over 3.5 million women who are currently living with breast cancer in the United States. So it's a pretty large amount. And they found that for every 100,000 women, there were 127 new female breast cancer cases, new women that were diagnosed. And it's estimated that 12.9% of women will be diagnosed with breast cancer at some point in time in their lifetime. So that's a large amount of people out there. Chances are, someone that's been diagnosed with breast cancer, you yourself have been diagnosed with breast cancer, and that's why you're joining this talk. Someone close to you, and also both, maybe you yourself and someone close to you has been touched by breast cancer. These women who are now living in their survivorship role are 41% of the entire population of cancer survivors. But they're saying, when we look at breast cancer and survivorship, we tend to address the biggest concerns. We talk about treatment, we talk about, what all is going to be happening. But afterwards, when you enter into the survivorship role, one of the number one concerns that people have is sexuality, sexual functioning, and this new stage of life, this new role, and this new body that they're left with. In 2010, they did a survey that showed that sexual functioning and satisfaction was ranked the third most frequently reported concern among women. But despite the fact that it was the third biggest concern that they had, less than 50% of women actually received medical care for one of these concerns. It wasn't being talked about at their appointments. They weren't bringing it up to their healthcare providers. And so this is a big concern that we have, that these needs and these concerns aren't being addressed. So what kind of concerns are we looking at? Because we know that these sexual concerns can lead to significant emotional distress, sadness and depression. Issues related to personal appearance is probably, one of the main things. Stigma. Do other people look at me differently now that I've had this diagnosis? How is my partner going to handle it? How are those around me going to treat me? Do they see me differently? And will this have a negative impact on all of my relationships? Primary concerns that women stated were concern about body image, sexual side effects, including decreased libido, dyspareunia, which is pain during sexual intercourse, and then the medication side effects that come along with some of the chemotherapies, with the long-term medications that you may be on, and how those then in turn relate to both your overall well-being and also your sexual concerns that you have. And then also concerns, as we're having younger women diagnosed with breast cancer, what does this look like for me as far as my family in the future? Do I have any limitations as far as my fertility or my ability to have further children? And how does that affect my role as a mom or as a wife? And so all of these things were really important to women. So I'm just going to take a little bit of time to break down a couple of the main ones, some of the things that people are concerned about, and maybe some options going forward with them. So the first thing that women tend to talk about is this now change in their body image. Oftentimes surgery is part of the treatment plan. And there's different types of surgery that they could have, and then what you can choose to do afterwards. So the first thing is mastectomy, having a removal of either one or both of the breasts. You can choose to do reconstruction at the time of surgery, where they place expanders or they do reconstruction to the tissue there. But not everybody decides that they wish to go through this at the time of their surgery. So afterwards, what are options? Well, there are options for something called breast prosthesis, and that's where you actually get a prosthetic breast that fits into a pocket into a specialized bra that you can have. And then when you're wearing your clothing, it looks as though both breasts are present. Really important part of this is that this bra and this breast prosthesis needs to be fitted to you. So there are places that you can go to have this done. I can't recommend enough the boutique at Altman. It's located at the main hospital in the back. There's a whole breast cancer area back there, and they're able to do fittings for you. You can have a mastectomy bra fitted. They can talk to you about the breast prosthesis. And they also do things like swimsuits, which is another time when having that prosthesis there would be helpful. And this also can be oftentimes placed through your insurance. So if you get a prescription or an order from either your oncology provider, sometimes your gynecologist, a lot of times they will allow you to have one or two of these prosthetics and these mastectomy bras per year, depending on your insurance coverage. So, but again, really important that you have this fitted to you, just like you would fit your bra, regular bras, making sure that this is fitting correctly, both for your comfort and also just so that it's not causing more problems with the skin. Another option that you could do is something called a nipple prosthesis. And this is where you actually get a silicone nipple that would either go inside, again, into your bra, or also sometimes just places over the skin and looks as though there is a nipple there. Sometimes with the breast surgeries, the nipple is not able to be saved, and so it is absent. Again, this is something that you could talk to them at the boutique. You can also order some of these online, but just allows, again, overall with the fit and the look of your clothing. Some women, however, decide that they're not going to do anything. They're just going to do what's called going flat, and they, don't end up having any reconstruction, or they don't wear any prosthesis. They just allow their clothing to be flat over, and they don't wear a bra on that side. And then I found it really fascinating. There's a ton of information online, but one of the newer things that women will do is they will actually get a tattoo over the area of their mastectomy or over the area of their lumpectomy, where they will have something meaningful tattooed over that area, be it a flower or a bird or a saying that allows them to cover up some of the scarring, but is meaningful to them in that situation. So I didn't post any pictures of these just because I didn't have any permission for them. But if you go online, there's some really interesting images out there of what other women have chosen to do as far as tattooing over their mastectomy sites. All of this is a very personal choice for each individual as far as what is going to make them the most comfortable with their body now that they've had this breast cancer diagnosis. Sometimes women won't have the full breast removed. They'll have what's called a lumpectomy, where you just have part of the mass taken out and the rest of the breast stays. However, concerns with this is, that the breast is not as even or not, the same shape. And so this can be a concern as far as body image. Will people see me the same? Will people, especially with their partners, with their significant others, will they, find that there's anything wrong with the fact that my breasts aren't the same shape that they were? And this, with talking with them with open communication is going to be really important. The other part of this is a lot of times women will then undergo radiation therapy afterwards. And this puts you at risk for something called radiation dermatitis, where the skin is irritated and inflamed afterwards. This does most often improve after the completion of treatment. So once you have completed your radiation, this should start to improve over time, but it can take upwards to months and maybe even years for this fully to resolve. There's some information that placing vitamin E, you can get the capsules or the oil over the counter over top of the area. Obviously, once your skin has healed and you are okayed by your radiation therapist or radiation oncologist to do this, but putting some vitamin E over the area can help with the skin and with the scarring. But another thing that's really important is passive range of motion. So moving that area, keeping the arm moving that range of motion to keep the skin mobile. Could even look into physical therapy. They can, evaluate and give you some good exercises to do at home for this. A lot of times, though, when you've had these big changes to your body, can be really difficult to, look at yourself the same. And so when I was preparing to do this talk, I went online and found some really great resources in recommendations as far as how to approach this. And everything that I kept looking at in all of the studies that I kept seeing showed that the more exposure that you have to this change in your body, the more that the negative thoughts would decrease and that acceptance of this change would happen. And so I found this really great steps. It was actually from a website in the UK, but I thought it was still applicable to here to us in the States. And they recommend doing it in a stepwise approach. So starting looking at yourself in a full-length mirror, fully clothed, and it really, really important. Everything that I read said you really need to focus on the positive rather than looking. It sounds silly, but the positive self-talk. Looking and saying 3 things that you really like about yourself, 3 things that you like specifically about your body that is still there. My body is strong. I like the way that my smile is. I like my skin. Then doing the same thing, but slowly becoming less clothes. So wearing either something that makes you feel good as far as underwear or lingerie or pajamas or whatever the next step for you would be. And then once you've gotten to the point that feels good, and again, saying what you like about your body, what you feel is good about your body and what your body has done for you, how strong your body is. And then when you feel that you're ready, then going and looking at yourself actually without clothes on in the mirror, looking at your areas where you had your surgeries and being able to look at it and go, okay, this is different for me. This is, what I don't like, but here's what I do like as well. And then most important, being able to touch the areas where you've had surgery, where your scars, where the reconstruction is, in order to fully embrace that area. And the recommendation is the more often that you do this, the more often you look at yourself, the more often that you feel your body, the less different it will seem and the more accepting you will be of that area. And this is also true for your partner as well. A lot of times we're very concerned that if there's been a change for us, will our partner, accept our new body? Will our partner feel like we're less because there's been surgery or things have been changed? And the more that you can be comfortable with yourself and more exposure for them as well, the better that it is. But also keeping in mind that there's a good chance that your partner is just as concerned for you and they're just glad that you're there for them and that you're doing well. And so a lot of times they're not concerned about those changes other than the fact that it's causing you to have any concerns about your body image. So open communication, practicing this self-love, being able to look at yourself, being able to touch yourself, and the more exposure that you can have, the better. Hair loss is another part that fits under that body image. Many of our chemotherapies, especially for breast cancer, do cause most often temporary hair loss. There is always the risk that it is more permanent, but most often this temporary hair loss. Sometimes people will decide that they just want to let it go. They won't put anything. They'll maybe wear a head wrap or a scarf. But there are lots and lots of different options as far as wigs. Once again, you can always check with your insurance. A lot of times, if you have an order for it, for what's called a cranial prosthesis. So again, a wig, insurance will help either purchase one or offset the cost for you. And then, there are so many different options that are available. Everything from your synthetic hair wigs to the natural hair, which is made from the donated hair. I know a big concern that I heard from a lot of people when they were talking about wigs is just how hot they would get. And is it going to be too warm on my head? And so they make them with, without the caps in them so that you can just wear them straight. They actually make more expensive, obviously, but they make ones that they attach each individual hair to these different fibers are called monofilament wigs. And those are nice because they can actually be styled different directions and has more movement and flow on the head. So lots and lots of different lots of different options for you as far as wigs are concerned. This also, like with the breast prosthesis, really great if you can go and get a professional opinion on them. The two places that I can't recommend any higher is a place called Golden Gallery. It's on Whipple. And I've put the number on here and also what their hours are, but you can go in there. They have lots of different options in the store. They will work with you. They will talk to you about what it is that you're looking for. What, do you want the same type of hair that you have currently? Do you want something different? Do you want to, have you always wanted to be a redhead and now you're going to try it? Have you always wanted long hair or short hair? And they can work with you that way. And they'll have options in there. The other place that I think does a really great job is the Wig Style Center. It's on Tusk. It's right in front of Altman Hospital there. They also have lots of options. They're very knowledgeable. They can talk with you about what options you want as far as that's concerned. There are many places online that you can also order wigs. The one that I had recommended to me the most was this paulayoung.com. There's lots of different price points as far as wigs, but again, this is a place where you can't try it on ahead of time. So definitely, if you know what you're looking for, what kind or what type of wig you would like, what you want to pay for it, that may be an option, especially if you want like a second wig. If you've gotten your first one fitted and you're looking for a second one, really great option there. I was looking through our emails for work the other day and saw that they're actually doing a wig consultation at the Shops Boutique. So again, that's the area in the back of the gift shop at the main hospital in the gift shop there. And they're doing a free private consultation with a group called Wild Orchids. It's going to be on November the 1st from 11 a.m. to 2 p.m. You're allowed to walk in and go there. They're not going to ask any questions. They'll just help you get fitted and see what's going to work for you. And there is a phone number there that 363-4902 if you had further questions or would like any more information there. So this was really great timing that this is available, at the main hospital. So local to us. Then looking a little bit further at sexual side effects, I think this is probably, one of the main concerns. There's lots of changes that goes on with the body. A lot of times the treatments that we give for breast cancer will cause basically an early menopause, whether that be through chemotherapy or some of the longer term hormonal therapy. And then often, a lot of times women will end up having hysterectomies for further treatment or prevention as far as their treatment plan as well. So anytime that happens, we have a drastic decrease in the estrogen levels. This then in turn causes the walls of the vagina to be thinner. It causes them to be less flexible and they produce less lubrication overall. So this causes us to have more vaginal dryness as women. So this can be, cause not only, pain and dryness during sex, but just even in general life. The labia will tend to be a little bit more irritated. And again, the less flexibility, less lubrication there. So several things that you can try for this. First of all, avoid anything irritating. It's not a good idea to put, regular lotion lotions, any deodorants, definitely no douching or anything to the vagina. You want to let it kind of take care of itself. But there are specialty moisturizers that you can purchase over the counter that can be helpful in adding to those tissues. So the one that I recommend the most often is something called Replens. It is a vaginal moisturizer. You buy it over the counter. The key is it's not a long-term solution. So it is something that you need to use more frequently. You need to use it every several days to almost every day. It can last upwards to 3 days, but in my experience from talking to other people, it doesn't tend to last quite as long. This again is a moisturizer for the vagina, for the labia, and can help hopefully allow that area to not be quite so dry. There are other brands on the market. Luvina is another one. Vagisil has its own moisturizer. There's one called Good Clean Love Restore. All of those would be options. And again, they're over the counter that you can purchase. Amazon has them. You can order them in. But again, the key is you need to use them more frequently. Lubricant is another thing. This is something that you would use obviously in the act of sexual activity. So, if there's a time when you're, getting ready to have sexual activity, you would want to use a lubricant at that time. Again, examples: KY jelly, Astroglide. You tend to want to trend towards a water-based lubricant, if at all possible. I did find that many of the companies, especially KY and Astroglide, if you go onto their website, they will send you free samples. So if you're not sure how you're going to handle a lubricant, if you're not sure if it's going to be one that you're going to do well with before you have to invest in a bottle of it, you can go there and they will send you some so you can see if you're sensitive to it. Most of them tend to be fairly, doesn't tend to have a lot of harsh ingredients in them, but it'd be something that you could try. Do stay away from anything that advertises things like warming or tingling, or just because they tend to have more chemicals in them that can be irritating. And then there's a large variety on the market. Again, I just throw out 2 that are the most common, but there's lots on the market. So if it's something that's important to you, that you need an organic or vegan or paraben-free, there are many, many options. And again, I highly recommend going to the different manufacturer websites. A lot of times they'll send you free samples. The nice thing is that you can use both the vaginal moisturizers and lubricant alongside of each other. So you can use the Replens every couple of days, and then you can use the lubricant when it's time that you're wanting to have any sort of sexual activity. Another important thing to keep in mind is that your sexual positions may need to change if you're having any problems with vaginal dryness, depending on how the pressure is or what position that you are in. Just by changing the position that you're in, whether someone else is on top versus on the bottom, may help. It also gives you more control over the speed, the depth, and so that can be helpful with decreasing any discomfort. I can't stress enough, speaking to either your oncologist or even your gynecologist, for this next one, but occasionally women may be appropriate to use a low dose vaginal estrogen cream. Now, this is not an oral estrogen. Obviously, having breast cancer would not want you to take any sort of oral hormone replacement. But occasionally, depending on your diagnosis, taking a low dose cream where you actually apply it to the external vagina can be helpful. And so that would be something that if you've tried the moisturizers, if you've tried the lubricants and you're still having problems, that may be a discussion that you wish to bring up with your oncology provider or your gynecologist at your next appointment, just to see if that would be an option for you. Decreased libido is another side effect, especially coming with any of the menopausal symptoms. All of them can compound together, causing a decrease in sensation during arousal. This can then lead to longer time to orgasm or lessen the intensity of the orgasm, and then overall just decreasing the desire to have sex. Things that recommend for that: psychotherapy. So any sort of counseling would be really important to kind of talk about. Is there anything that could be helpful as far as increasing that sexual desire. There are specialty sexual therapists, and at the end of this, I do have a couple of websites where you can look to see if there's anyone local. A regular counselor could be helpful as well, but there are some counselors that are specialty trained in discussing these sexual issues, and oftentimes even are well versed in the changes to libido from a cancer diagnosis. Support groups are really important as well. With COVID, a lot of them are not meeting in person, but there's lots of different options online. And with the invention of social media, for its good and its bad, there are a lot of online groups both through Facebook and Instagram and other breast cancer survivors who may be able to give not only support that this is a fairly common part of the life after breast cancer, but that also they may have suggestions or helpful tips. Relaxation techniques, sometimes being able to go through some deep breathing or some different rituals in order to get the mind more in line with getting ready for sexual activity can be helpful. Communication with your partner, with your loved one, with your significant other. Being open with them a lot of times is the most important. Putting the emphasis maybe off of the actual sexual activity itself and getting more to where you're having times when overall sex is not the object. You're actually just enjoying each other's company, and then when you're ready, getting back to that place in your relationship, being open with them about how you're feeling and what the concerns are and what your needs are. Sometimes you may need to bring in other stimulation techniques or other things that will help with arousal, getting in the mood, especially, a lot of times this may be newer for people if they hadn't had to use them before. Things such as, erotic literature, videos, the use of a vibrator, trying different things in your relationship with your partner or by yourself, trying it by yourself before you get with them to see what you like, what you don't like, what helps in that situation. And then, doing with your partner, again, things other than sexual activity that may take that pressure off, things like, a massage or a foot rub, just putting that emphasis off of that actual, sexual intercourse and allowing the emphasis to be on how you feel and that connection with your partner and taking it slower at that point. You may need to be very open with your partner, telling them what feels good, what doesn't feel good, what touch, what used to work may not be the same at this point, and being able to tell them or show them or guide them in that direction. A lot of times, especially with breast surgery, you may not want your breasts to be touched. You may need to tell them that, or it may not feel the same. And so that feeling and that arousal that you used to get with that may not be the same. And so being able to communicate with them so they understand what works for you is going to be really important. Fatigue is probably one of the most common side effects that most everybody who deals with breast cancer, who goes through a breast cancer diagnosis, encounters at one point in time. Just the act of having a cancer diagnosis itself can cause fatigue. Chemotherapy for sure causes fatigue, so does radiation therapy. And this is defined as extreme tiredness that doesn't go away with rest or sleep, no matter what you do, just feeling very, very tired. The problem with this is, again, it affects both quality of life, it affects your activities. At this point, as far as relationships are concerned, you may not want to have sex or be as active during your sexual activity. The the sheer act of just having sexual intercourse may be really exhausting. The biggest thing is exercise, being as active as possible, getting those endorphins going, keeping the body moving. Even if that exercise is a 5-minute walk out the front door to get your mail at the end of the driveway and coming back, the more that you do it, the better that you feel. And I know that when you're really, really fatigued, the thought of even doing a little bit of activity is really difficult, but truly the more that you can be active, the better that you are. Being active throughout the entirety of your treatment process, starting that exercise from the very beginning, that you, the very first moment that you get your diagnosis clear through, really helpful. That's probably the number one recommendation, is that exercise, staying active. And then again, taking the pressure off of the situation, spending time with your partner with no sexual expectation, enjoying each other's company without the expectation that something needs to happen afterwards. And then if you feel like the fatigue is just, really, really more than it has been, or if it changes, or things just really aren't working, always feel free to talk with your treatment team, with your oncologist, with your radiation oncologist, with any of your other healthcare providers. Sometimes there are other underlying causes, such as anemia, or things that need to be addressed as well. So even though we say that fatigue is a very common side effect, it is a very common symptom that we see, if you feel like it's really affecting your life, please feel free to speak up with your team and let them know, and so that they can see if there's anything else that needs to be addressed. Dyspareunia, this is painful sex. So anytime that sexual intercourse is painful, that is something that needs to be addressed. Often this is the result of hormone changes. Again, that vaginal dryness, that decrease in estrogen, sometimes related to the chemotherapy or the medication that you're having. Please speak up and talk to your cancer care team. Please talk to your gynecologist if this is occurring. If you've tried these other aspects, if you've tried the next couple of recommendations and you're still having lots of pain during intercourse, it's really important that you speak up with your care team so that they can address any further issues that are going on. With that being said, again, things that you can try: water-based lubricating gel, using more of that lubricant than you had to use before, possibly, or a different type, or making sure that you're using enough of it. Really important that you have enough arousal ahead of time for play. Again, that maybe getting together with your partner without the expectation of any sexual activity. And then, if you're able to get that arousal state, then going ahead, but making sure that you're to a point where that's, where you want to be. Sometimes if you're having a lot of muscle pain or joint pain, especially from any of your treatments or, any other parts of your diagnosis, you can try doing like a Tylenol or an ibuprofen beforehand. If hey, I want to try to see if I can decrease this, discomfort by this evening or within a couple of hours, you could try doing that. Another thing that I don't think we're always aware that exists is something called pelvic floor physical therapy. So this is a physical therapist who has actually gone ahead and gotten certification and further treatment as far as pelvic floor disorders. And this includes this painful sexual intercourse, and they are very familiar with the changes to the body after a cancer diagnosis and cancer treatment. We're very fortunate here at Altman that we actually have these pelvic floor physical therapists available at the Altman North location. So that's up on Whipple Avenue for those that aren't aware. You just call the number, and I believe for most insurances and for most situations, you don't even need a referral. You can just call. Although that being said, I think the alt care, you do actually need a referral. So you could ask your, either your primary care provider, your oncologist, any of those, to get you a referral to them. But they are wonderful. They will do an assessment, they will talk with you, and they're able to do some treatments in order to help with any of these different problems that you're having. So really, really can't stress enough this wonderful service that we have available. And then again, trying new positions that allow control of the movement during sexual intercourse, and open communication with your partner. What causes pain? What doesn't cause pain? What do you like? What don't you like? Being as open as absolutely possible, and communicating what is working and what isn't working for you. Medication side effects. So many times, women, even after they've completed their chemotherapy, their radiation, they're placed on these other medications, aromatase inhibitors, tamoxifen, and they do come with their own set of side effects as well, which can cause problems. Hot flashes is probably the number one side effect that we hear about. Different things that can be tried. So of course, again, always talk with your oncologist, always talk with your provider. If you feel like these are just becoming really, bothersome, if they're affecting your daily life, and they can talk to you about different options, including medications like I have on here oxybutynin or an SSRI, which is usually used for depression, but can be helpful in these situations. They would be able to look into something like that. But outside of that, there's actually been some literature that shows some relief of symptoms with acupuncture. So, going to see an acupuncture provider can be helpful with some of those. Cognitive behavioral therapy, so counseling, getting set up with them can actually help with hot flashes as well. And then exercise, good old exercise again, that's been shown to reduce some of those symptoms. Muscle aches as well, you can use hot or cold packs to the area. Exercise again. Sometimes your over-the-counter medications, Tylenol, ibuprofen. Again, acupuncture, there's actually really a lot of information out there on the effects and the success of acupuncture. Eating a healthy diet, just making sure that you're, fueling your body, eating balanced. There's some that says that, increasing your vitamin D and calcium can be helpful. And actually, this is a good idea no matter what, just because, again, going through the decrease in the estrogen in the body puts you at risk for more of an osteoporosis. So increasing your calcium and vitamin D can be helpful. Massage is another thing that can be helpful, especially for more of the muscle aches. Going to a massage therapist, that also occasionally can be covered by insurance. So it's always a good idea to check with your insurance provider and see. Sometimes you need an order for it. Sometimes you're able to just go ahead and go. And then Reiki therapy is another thing that we actually do offer here at Altman. It could be something you could talk to your provider about getting set up. That's where they actually use the energy of the body and place hands around the body. And it's been shown to alleviate some of the side effects from those medications. But again, if your symptoms are to the point that you're really feeling like it's affecting your everyday life, speak up with your healthcare provider, make sure that they know what's going on. There may be options that they can talk about, either, again, adding an additional medication or possibly switching. There are different types of these medications that they can try to get you set up with if you're feeling like the side effects are just really affecting you. Then with our, again, with a lot of women being younger, being diagnosed with these cancer diagnoses, going through treatment, the question is always, what do I do about my fertility, about further pregnancy? Obviously, really important that you are talking with your provider throughout all of this. I just found the overall recommendations, but these can be specific to each individual person. But important that you're, taking some form of contraceptive while you're going through chemotherapy, while you're on these medications afterwards. And then again, because of the nature of the cancer, we don't want any hormonal birth control. So there are definitely different options, your barrier methods, condoms, diaphragms. There's an IUD that does not have any hormones in it, it's copper. And then, your obviously your permanent sterilizations like tubules. I guess vasectomy isn't necessarily permanent, but that would obviously involve your partner. And then some behavioral ones such as abstinence, withdrawal, natural family planning. These do take a little bit more effort as far as knowing your body and have a little bit of a higher risk of failure. So knowing what's going to work best for you and for your family. And then again, just discussing with your gynecologist, with your oncologist, as far as what their personal recommendations are for you, as far as how long to wait before attempting any sort of further pregnancy or anything. I did put a list of resources at the end here. So the first one, there's a really great resource online. It's called youngsurvival.org. It is a resource for younger women who have been diagnosed with breast cancer. There's information on finding local support groups, just a lot of information, as in relationships to these younger women. Then the next two, this AASECT, that one is actually the American Association of Sexuality Educators, Counselors, and Therapists. That one, and then the next one is the International Society for the Study of Women's Sexual Health. Both of those websites have links as far as finding a sexual health therapist or counselor locally, or someone who's affiliated with them. And so those would be two really great places that you could go to find a counselor specific for any, again, counseling as far as sexual health. And then the Common website does have great information as far as support, local resources. There's both online, telephone. Again, with COVID, a lot of stuff has been moved online, which is great because it actually gives access to things that are outside of our local region that you may be able to be a part of. Then last, I found this really nice, let's see if I can open this. On Breast Cancer Now, whoops, I don't know if I just messed it up. There was a really great form that was a prompting of things that you could go and talk with your provider about. So again, this website is actually based in the UK, but I thought it was a really great list of things that you wanted to talk to your provider about. Everything from changes to your body, to intimacy, to physical issues, emotional issues. And what I liked about this is it was a very straightforward, you could even, if it's something that you didn't feel comfortable going in and talking about, or if you felt, any sort of, again, discomfort about bringing up these situations, you could even take this paper or something similar, check off the boxes of what you wanted to talk about and hand it to your provider so that they're aware. Again, 50% of women don't talk about these issues, but they're very important in your day-to-day life. They're very important in your your survivorship care is addressing these issues that you may have. And so whether it's you feel comfortable with your oncologist or with their staff or whomever, bring up these issues that you're having. Don't be afraid to say, this is a problem, or this is a concern, or what recommendations do you have? So this, again, it's online. There's several different versions of a similar prompt list for discussions, but I liked the way you could literally just check off things in order to help kind of start that conversation and be able to be open with your provider about things that are going on.